Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. Now we have an overview of the matrix multiple choice NGN question type. All right, looking today at matrix multiple choice items. It's another one of those brand new item types that'll be available on the NGN exam coming in April 1st, 2023. It's another one that looks a little scary at first because it's in the shape of a grid. There's lots of buttons to click on, just like the matrix multiple response version. But this matrix multiple choice, I think, is pretty easily broken down into like one row at a time, one question at a time, and it's a little bit easier to think about. This is our sort of silly fun example before we get into a more clinically realistic one. This one is about a child performing a learning activity. So we're asking the child to identify shapes versus colors. So the actual structure of the item is just two columns of like a category, an overarching umbrella category, and then you pick out what fits under that category. So for each of the words below, click to specify whether the word's a shape or a color. So starting off red is a color. So we can click here for that first slide. And then on the next slide, I think we fill in the rest of the boxes. There we go. So really it's just thinking through like red, shape or color, square, shape or color. If you break it down row by row, it's really just a row of single one answer questions. So I think that's helpful versus the other one, which can be multiple rows applying to each column. This is you only pick one per row and the computer won't let you click more than one per row, which is helpful. So then let's look at how it's scored. So here, just like the other ones where the computer tells you how many boxes or answers to give, it gives you 1 point for correct answers and then it does not take away points for incorrect answers. So here you can see that we got a point for knowing that red was a color and square is a shape and then blue is a color. But then here, I think with all the circles, we got mixed up. We hit the wrong one and we got 0 points for that one. But then we got another point for triangle. So all total, we got 4 points because we got 4 correct options out of the 5 possible. And then no points were removed. So one of the exciting things about NGN is this partial credit scoring. So we can clearly tell the student still did well on this item, even though they missed one. So there wasn't a need to get the whole item wrong. All right, switching over to see a more nursing-centric, clinically realistic item. This is the same case study that we've been working through for the NGN item type videos. This patient is the 20-year-old female who has DKA. She's been in the emergency department for these initial symptoms. And then right now we're taking care of her 5 days later. So she's here in the medical surgical unit and we're kind of given an update here. She's preparing for discharge, received successful treatment for DKA. She was actually newly diagnosed with type 1 diabetes. We've given her a few different kind of medications to take it home. And then we made sure, and this is definitely a nursing-centric intervention, is we always make sure our patients have a follow-up appointment before they walk out of the hospital. So she has a follow-up appointment scheduled with her endocrinologist. We've got some vital signs here, which look good. And then her finger stick blood glucose looks great. So she is all set to go for discharge. So we just want to make sure all that teaching, which again is very nursing-centric, that we gave her is appropriate. So here we'll go ahead and evaluate whether or not the statements that she is making about the teaching she learned are correct or incorrect. So it's again just sort of breaking it down row by row. So let's read the nurse provides teaching. And here it kind of sticks out where we say managing diabetes during an acute illness. So we know that some of these options are going to be related to what do you do when you're having like a sick day and you're also a diabetic. For each of the statements made by the client, click to specify whether they indicate correct or incorrect understanding. So looking here at the first one, it says, I should not take insulin if I cannot eat due to nausea, which makes sense because if you're sick, you can't eat, you're not getting sugar, then maybe you shouldn't take insulin. So maybe you would click, that's a correct understanding because you think, yeah, maybe she shouldn't be taking her insulin when she's not feeling well because she's not eating. Some of the other options, I should drink fluids and stay hydrated when I'm experiencing an illness. Absolutely, that's true for everybody, especially for patients with diabetes. So I will check my blood glucose levels more frequently during an illness. Absolutely true. Just because of the stress, inflammatory response of having any kind of acute illness like an upper respiratory virus or a stomach bug, there's a lot of, inflammatory processes going in your body. And so it can really throw things out of loop, especially things like your blood glucose level. So that's absolutely important. And then I need to check my urine for ketones in case glucose levels are persistently elevated. Yes, monitoring for ketones is absolutely important because can be one of those early signs that DK is impending, that, you're not able to compensate with fluids, your sugar is high, you're becoming acidotic because of a buildup of ketones. And so here's the way you can catch it early. So that's definitely true. And then here she's saying, I will reduce my carbohydrate intake if I experience high glucose levels during an illness. We actually do expect glucose levels to go up during an illness. But do they need less nutrition? Not necessarily. They still need nourishment to heal from their illness. So we wouldn't necessarily tell them to reduce your intake of anything when you're experiencing an illness. So I'd say that's probably an incorrect statement. Go ahead and submit here. Oh, we got the first one wrong. So let's look through. Yeah, so here's a great teaching point. Clients with type 1 diabetes, they have to continue eating and using insulin even when they're sick. Otherwise, it can precipitate TKA. Their blood sugar is going to go up because their body is under stress, so they need that insulin. They need to keep eating. Otherwise, their body will start to develop ketones, and that acidosis will occur. The student got 4 out of 5 points for this item because, again, they got one wrong, but we didn't take a point away because we asked them to answer it. So 1, 2, 3, 4 points correct, 4 out of 5. Nothing is subtracted. And again, there's that little hyperlink with the scoring rule, which is helpful there. Whether you're taking the current NCLEX or the next generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN and to start practicing today. Thank you.